My name is John Watson. I am originally from Galesburg, Illinois, which is a small town in central Illinois. I did my medical school training at SIU here in Springfield, and so I'd worked with a lot of the physicians here at OCI prior to coming back here. And then my residency training was in a small field called physical medicine and rehabilitation, and which makes me a physiatrist, or if you're on the East Coast, a physiatrist. I am a non-surgical specialist, so I try to treat patients non-surgically. Most people don't want surgery, of course, or don't need surgery. So I use a lot of tricks and technology to try to help their symptoms, help their pain. The most typical type of patient that I see is someone that has pain either in their back or neck that kind of shoots into the shoulder or hip area. And it's my job to determine if their pain is coming from one of those areas, both of those areas, and treat it accordingly. You know, a lot of patients have sciatica, numbness, tingling, burning type sensations, and I'm able to use the technology like EMG testing, injections to try to help not only diagnose their symptoms, but help treat their pain. My favorite thing to do is ultrasound. So diagnostic ultrasound is a new technology that allows me to take a probe, look inside the patient's body, whether it's their shoulder, hip, or knee, their wrist, their foot and ankle, not only see what the structure is that might be causing the pain, but then direct treatment right to that area. And now we're trying to treat things, you know, with very small incisions, minimally invasive. And now with ultrasound, we're actually able to treat some of these things with biologics. And so the future, I think, of orthopedics and musculoskeletal outpatient physiatry is going to be biologics, whether that is PRP, stem cells. We're using these regenerative processes now to actually guide the procedure right to where the problem is so that it doesn't affect anything else in the area, and can really treat this without all of those major surgeries. And whether that's, you know, the knee, the hip, shoulder, foot and ankle, I mean, really the options are immense, and we're just starting to scratch the surface of it, I think, now. I love to stay active, exercise in my downtime. Unfortunately, a lot of times I like to research ultrasound and non-surgical orthopedic stuff in my free time because I enjoy it so much. But love to live here in Central Illinois. It's a great place to live, great place to raise a family, and glad to be here at OCI.